Today's topic is how to handle death of a patient. Now, unfortunately, in our country, there is no legal definition of death except that brainstem death is defined in the Human Organ Transplant Act of 1994. The basic duty of a doctor in case of death of a patient is to diagnose the death, followed by filling the death report, which has to be done within 72 hours, and finally, if the cause of death is known, giving the death certificate. Now, in some cases, handling mob also becomes a part of the job of handling death. Now, some medico-legally important questions are, it may be prudent, but is it mandatory to inform all cases of death on table to police? The answer is no, because supposing if you are operating on a cardiac case and there is a death on table of an ASA grade 4 case, then all these cases need not be informed to the police. In our practice, since we manage young patients as obstetricians and gynecologists, and these young patients are not generally expected to die on table, it is prudent to inform the police so that the police can investigate the case and decide whether there is anything suspicious. And if they feel that there is something suspicious, they can send the body for a MLCPM. This brings us to the second question. Is it our duty to convince the relatives for MLCPM? The answer is no. It is not our duty. It is for the police to decide about MLCPM and convince the relatives to do so. Lastly, is it mandatory to ask for PM for all cases of death on table? The answer again is no. If we know the cause of death, no law in our country prevents us from giving the death certificate. However, being gynecologists, again, our patients are often young, death on table is not common and expected occurrence, and if the case goes in court, we being the accused, DC given by us would always be seen with suspicion. Hence, it is prudent to see that the PM is done by the PM surgeon. Thank you.